Welcome back to some more health accumulation. So a fasting blood sugar between 100 and 125 milligrams per deciliter gives a person a nearly 300% increased risk of coronary artery disease. Coronary artery disease is basically when your coronary arteries, the big arteries around your heart, fill up with plaque and leads to heart failure and heart attacks. So people with a fasting blood sugar 79 milligrams per deciliter and below did not have this 300% increase. All right, so be sure to like, subscribe, so others can accumulate as much health as possible, and so you never miss out on this fantastic information. So like I said, a blood sugar of 100 to 125 increased the likelihood of coronary artery disease by 300%. So consider that diabetes is diagnosed at 125 milligrams per deciliter. So if you're going to wait to make lifestyle adjustments until you are officially diagnosed with diabetes, you are already way behind. And it is highly desirable to step up the plate now, before that disease process is in full steam. Because the thing is, like you can see from that 100 to 125, the study, that before you even get to diabetes, the body is already full steam in a negative pattern, a disease-associated pattern. So understand, type 2 diabetes is a lifestyle-induced affliction. I know it's tough to hear, but that means we bring it upon ourselves. Unlike type 1 diabetes, which I would say it's reasonable to suggest and to say, cast blame maybe, even on your genetic lineage, parents, grandparents, great-great-grandparents, and potentially exposures that were completely out of control. Because usually you're diagnosed with type 1 diabetes, that's not a metabolic condition when you're young, a child. Type 2 diabetes, not so much. It's all about the history of your lifestyle. So if you want pain, numbness, neuropathies in your feet, you want ulcerations that will not heal, you want dullness of thinking, fatigue, lethargy, just lack of motivation, low hormone levels, muscle loss, atrophy, overall just decreased life function, that is your choice. But please understand, your blood sugar is a modifiable factor that's directly associated with your lifestyle. How your body manifests is directly associated with your lifestyle. How my body manifests is directly associated with my lifestyle when it comes to blood sugar. So we can make choices every day to completely change the status of the sugar floating around in our blood. So if you're concerned about feeding high blood sugar trends in your family tree, geesh, a lot of people in my family have issues with blood sugar, with diabetes, these kind of things, having to get legs amputated because of blood sugar, or you're noticing that your fasting blood sugar is over that 90 milligrams per deciliter, I have 6 beautiful opportunities for you to support a better regulated sugar response. So the first one is go for a walk. Specifically, go for a walk after you eat. And guess how much walking I'm talking about? I'm talking about 2 to 5 minutes of walking. Isn't that crazy? Just 2 to 5 minutes of walking after you eat. And we want to do this optimally within about 60 to 90 minutes of having eaten our meal. So you don't have to have a treadmill. You don't have to have a gym membership. You don't have to go do some big CrossFit workout. All I'm talking about is the act of walking for 2 to 5 minutes. So you set the clock, you do some laps around the house, up and down the stairs, walk back and forth down your driveway, boom, 3 minutes, 4 minutes, I'm out. Or maybe you're gonna walk up and down the hallways of your office. I had one patient who would walk up and down the stairwell at their office. There's like 4 stairwells, one stairwell with 4 flights, and they would do that every day after lunch to help get their sugars regulated. All right. Number 2, build muscle. So the more muscle you have on your body, the more opportunity you have to utilize sugars. Now that's a blessing. In fact, when muscle tissue is contracting under resistance, so maybe I'm doing a squat, maybe I'm doing a lunge, maybe I'm doing some bicep curls, some rows, insulin is not even required to move glucose from the bloodstream into the muscle cell when that tissue is under resistance, when it's contracting under resistance. So this takes so much stress off our pancreas, which is what's producing all the insulin. And, it clears sugar from our bloodstream, your bloodstream, when you're doing those contractile movements. And the bigger the muscles grow, the better. The more tissue there is to slurp up that sugar. So when I like squats, lunges, pull-ups, push-ups, bench press, rows, thrusters, deadlifts, these really are golden movements as they require massive amounts of energy to perform, which helps clear massive amounts of glucose from our bloodstream. Bloodstream gets cleared of glucose, man, happy body, young body right there. All right, number 3, here it comes. Decrease or eliminate added sugars. This does not mean not eating fruit, dairy products, raw honey, actual legitimate sugars that are found in their natural matrix. This does mean looking at your package items and checking for added sugars. A simple gaze at a 6 ounce cup of yogurt, say raspberry yogurt, can have almost 5 teaspoons of added sugar. So you look at that label like, oh my word, there's 30 grams of sugar in here. And what? 28 of them, or not, 22 of them are added. And this is not abnormal. This is standard, unfortunately, when it comes to things like yogurts. So if you started getting plain yogurt and you just added your own berries, you could easily replace 80 to 100 teaspoons of added sugar a month. It's crazy, right? Crazy to think about. All right, so number 4, I believe we're at, drop the artificial sweeteners. You can do this. The idea of consuming artificial things, it just sounds completely odd, right? Out of the gate, why would I put something artificial in my body when I could put something that's completely natural? But unfortunately, so many of us have been trained into thinking that because there are no calories in the artificial sweetener, that someone makes it healthy or makes it a free food. In fact, there's all kinds of even governmental entities that say it's free. These are free calories. Diabetes is free. This, of course, could be not further from the truth. It's not free. In fact, it's costing a lot. The regular consumption of artificial sweeteners like Splenda, it's also known as sucralose, aspartame, acetylcholine potassium, or ACE-K, these synthetic artificial sweeteners have been shown to disrupt gut bacteria, leading to insulin resistance. So insulin is floating around more and more and more, and increased blood sugars. So I would eat, personally, my own personal body, I would eat added sugars every day of the week rather than any of these artificial sweeteners. All right, number 5, hydrate. So a dehydrated state of our being causes our livers to produce more glucose. It's like a stress response. There's not enough fluid, there's not enough water, which means excess glucose floating around in our bloodstream, oxidizing cholesterol, making cholesterol sticky, and then leading to plaque formation on our arterial walls, which is the end result: coronary artery disease, atherosclerosis, Alzheimer's, dementia, all that. So that's simply hydration, right? Just simply getting our water in on a consistent basis. And then here's the kicker, number 6. Sorry, I gotta say this, but popcorn. I didn't want to bring this one up, but I thought I gotta put this out here because I've had multiple patients who've used the 24-hour glucose monitors and have found, when you look at it, that when they eat popcorn, they get these huge spikes in their blood sugar, like 80-point spikes from eating popcorn. And this is not like Walmart popcorn. I'm talking like organic, non-GMO, coconut oil, butter kind of popcorn. So the problem with popcorn, I think a lot of times, is that we eat popcorn between meals or at the end of the day. And there's no movement with that. A person might be watching TV, surfing the internet, reading a book. And we're putting something in our body that unfortunately we've been told, we've thought was benign, because there's low calorie and the low glycemic index, it's just like this puff put in, right? But unfortunately, in my patient population who's done the 24-hour glucose monitors, we've actually found that it causes blood sugar dysregulation. And when that's taken out, blood sugar levels are consistently more even. All right, so I'm not saying you can't eat popcorn anymore, but do that 2 to 5 minute walk if you eat popcorn, all right? All right, I'm Dr. Matt. Hope this has been helpful. Please like, comment, subscribe. Let me know. how have you been overcoming the sugar monster? How have you been making sure that, pre-diabetes, diabetes, these things are not a part of your existence? Love to hear about it.